I want to get to my guest. His name is Dr. Gerald Edelman. He practices medical oncology. He got his MD from the University of Colorado and Ph.D. from the University of Southern California in cell and molecular biology. He's the author of the book Sugar Rehab, a guide with lists of foods to eat and lists of foods to avoid based on their sugar content. Doc, welcome to the Chris Salcedo Show. The first reason I wanted to bring you on was to talk about a study that fascinates me. I'm a coffee drinker, and I have been a coffee drinker for the better part of about 15, 20 years now. And a new study recently came out that there is positive impact on those who may be at risk, and being a Latino, I'm also at risk for diabetes. Those at risk of diabetes if you drink 3 cups of coffee a day. Go ahead and explain.
The take-home message from this study is it looks like drinking coffee is safe. 2 to 3 cups of coffee a day may help decrease your type 2 diabetes risk. I don't know how much your readers understand about type 2 versus type 1 diabetes, but type 2 diabetes basically is insulin resistance, and it's usually correlated with being overweight. The reason why that correlation is there is because fat cells are relatively resistant to insulin. I think the idea of coffee helping to reduce the diabetes risk is really related to 2 or 3 cups of coffee that you're drinking is increasing the sensitivity of your body to the insulin that you make. And there's a lot of unknowns in this, Chris. It's sort of an observational study. You know, they look at usually tens of thousands of folks in different cohorts, sometimes from different studies, and they make the observation, you know, those that increase their consumption of coffee by, say, 1 or 2 cups a day decrease their type 2 diabetes risk by, you know, a certain percentage.
This study was done by the folks at Harvard, and it was over a good many years. About 120,000 people were surveyed. And I wanted to ask you, too, that a lot of diet pills out there have caffeine as their main ingredient. Could this have something to do with maybe increased activity, physical activity among those who are juiced up on caffeine as a way to also to hedge off the onset of diabetes?
Yeah, well, you know, I don't know that the mechanism is exactly understood, so I don't think I'm going to pretend that anybody really knows the exact mechanism. But
right.
The speculation for it is multiple reasons why the coffee may help decrease diabetes. Number one might be what you're talking about. You know, caffeine stimulates you and may make you more active. It may make your baseline metabolism a little more active. But in some of these studies, they've looked at caffeine by itself versus coffee, and coffee seems to have more of an effect. So there's a lot of ingredients in coffee that seem to be pretty good for you. This might make you feel better, Chris, about drinking 2 to 3 cups a day, okay?
Yes, sir. Go ahead.
But there's antioxidants in it. You know, we all know and have heard that antioxidants help protect against cancer and other diseases.
Sure.
There's also some compounds in there that have been associated with protection against certain types of cancer. And coffee actually also decreases depression. So, you know, if you think about it, some people's response to depression is to overeat. So there's a lot of different factors, poorly understood, but the observation stands. I think those of you that are drinking 2 to 3 cups of coffee today, you know, are probably in pretty good shape. It's okay. It seems to be pretty healthy.
Excellent. Well, you know what? It seems that these studies come out every once in a while. Sometimes we get a study that says it's bad for you, but I think the preponderance of evidence at this point says that coffee's okay in moderation. My guest right now is Dr. Gerald Edelman. He practices medical oncology. And I wanted to bring you on. I'd be remiss if I get a doctor on the program and don't ask you about the impacts coming up because of the Affordable Health Care Act, or Obamacare in the common parlance. Have you seen any effects in your practice at this point from the Obamacare regulations that have been kicking in?
Yes, I've begun to see them. And, you know, I'll tell you, nobody really knew what was in that law.
Including our lawmakers.
Including the lawmakers. They didn't read it. It's insulting and infuriating because what's happening is as this plan unfolds, number one, it becomes clear that they really had no plan. It was very poorly constructed, right? You can tell that just by the way the website rollout was. So what I'm seeing in my practice right now is a number of things. Number one, A lot of patients are signing up for plans that just simply don't have that much good coverage. A lot of the providers aren't accepting the plans. And so, I heard you talking earlier about some of the promises about keeping your provider. Well, written into this plan are reimbursement levels that are sometimes at Medicaid or below Medicaid levels. Oh, and so some of the office visit payments are literally in the $6 to $16 range. And many providers just can't afford to provide care for that. So that's number one. Number two is the coverage for certain drugs like chemotherapy drugs. I'm an oncologist, very expensive. And these plans underpay, and sometimes I'm getting less than what I pay for the drug. So imagine a business where you're actually paying, I use the analogy of McDonald's, it'd be as if McDonald's were actually selling you a hamburger for less than their cost.
Right, so you're pulling up to the window and they're giving you $1 to get and a hamburger.
Yes. And,
yeah, exactly.
And then you're expecting them, A, to stay in business, and B, to provide good service. In America, this is the big thing, Chris, that I think, just as a philosophy. We are used to the best service in the world.
Sure.
I mean, we are used, as Americans, to getting timely service and good service. And I think this plan is starting to result in patients beginning to understand they're not going to get the same kind of service. They're not going to get the same broad access. And it makes sense. There's no way that you can lower the amount of money you're paying for anything and expect to get broader and better service. It's not going to happen. It's illogical.
Well, Dr. Edelman is my guest, and so I've got so many more things I want to ask you. We're going to have to schedule to get you back on the program maybe as soon as next weekend, because I've been bringing on other doctors who have banded together to get rid of insurance companies, to get rid of the federal government, and give their services, and I'm talking about basic services, office visits and minor blood work and all that kind of stuff. Your particular practice, though, medical oncology, that's a whole different ball of wax, and maybe you have some ideas on some solutions if we're going to be stuck with Obamacare and we're going to be stuck in this downward spiral, what doctors are going to be doing perhaps to get above and beyond this so that care around the country doesn't suffer. But we'll get you back on. Dr. Gerald Edelman, he is the author of Sugar Rehab, a guide in which foods to eat and which foods to avoid because of their sugar content. Doc, thanks for your time today on the Chris Salcedo Show.
It's wonderful being with you, Chris. Thank you.